محاضرتنا الآن شرفنا في هذا الملتقى العلمي الأول لطب الفم والاسنان جامعة الجزيرة. يشرفنا معالي رئيس جامعة جبلة الأستاذ الدكتور عبد الله المطري بمحاضرته لهذا اليوم، وهي عن impact of diabetes mellitus on oral wound healing. فليتفضل مشكورا.
السلام عليكم. طبعا الشكر لجامعة الجزيرة ممثلة بالرئيس مجلس الأمناء الدكتور عبد الرقيب صبيح، وللرئيس الجامعة الأستاذ الدكتور نشوى المجمر. فرصة طيبة أنه أنا بين هذه الكوكب الرائعة من زملائنا أطباء الأسنان والفيشيو ميكزيلري وزملائنا الأطباء الأسنان العموم. Actually, I'm going to talk about the impact of diabetes mellitus on oral cavity healings, and this is the subject. It is sharing between many specialties, especially dentist, facial maxillary, general surgery, and even surgeons which they are specialists in pediatric surgery. وإذا سمحوا زميلاتنا وزملائنا الأعزاء, please keep quiet if you please. We would like to share you these very nice lectures, if you please. Actually, before, we are going to define what we mean by wounds. What we mean by wound. Wounds is a disruptions of normal continuity of the body structures, whatever. It could be the skin or the underlying structures or mucous membranes caused by a physical injury. So this is the wound, and our work, how we can make these wounds to be healed in proper way. I try to give few lines about the pathology and some things related to the histological change in which can occur in patients with diabetes. The wounds can be pathological, traumatic, or surgical. Surgical mean iatrogenic, mean we are the physicians or the surgeons which we are doing the wounds. So, however, healings of the wounds has always been central consideration in surgical practice, because any breach in surfaces of the body will expose the deeper structures to damage by infections, irritations, or by any internal secretions or external irritation substances. So as Dr. Abdul Karim said, there is many factors which can affect the healings of the wound, not just if the patient is diabetic or non-diabetic. What are the biological processes of wound healings? Wound healings, it is just like the baby in the intrauterine life. It has stakes. It has times, okay, in order to heal. If we understand these biological phases, we can deal with the wound healings in proper way. Normally, for healthy persons, there are 3 phases wound healing, each which determined by time. So for normal person, there is 3 phases, each phase with the special time. When there is any pathology like diabetes mellitus, these phases will be prolonged and its histological arrangement will be disturbed. Okay? So the phase 1, which is the phase of inflammation, in which the inflammatory process will happen after wounding. This usually takes days, between 1 to 4 days for this phase. This will happen immediately after wounding. It will be started, in which in this phase will be change in tissue tension that will be results in change in charge of collagen molecules. The constitutions of the blood become in contact with the collagen and induce clotting. So hemolytic plaques will happen during this phase in order to stop the ooze of blood or the bleeding during this phase. The blood vessels will sustain brief vasoconstriction, which is one of the defense mechanism of the body in order to decrease the bleeding system. So there will be vasoconstrictions, then followed by vasodilatation in order then to supply the area of the wounds in order to get healings under the action of histamine released from the platelets and muscles, which will become blunting in this area of the wounds. As a result, the capillary permeability will increase. So this is which explain why edema is occurred during the woundings, because there will be increase in the capillary permeability. This results in edema in the area. Sure, the release of kinin, serotonin, and prostaglandins will keep the capillary engorgements, and then the RBCs and white pieces will escape from the blood vessels due to high permeability to the wound forming. Fibrin network surrounded with lymphocytes, polymorph neutrophils within 3 hours. So this is the defense mechanism of the body during the first phase, which we said it is inflammatory process. The monocytes start to come to the wounds and become the dominant cells at the 5th day. We said the inflammatory phase, it will be between 1 to 4 days. So during the day 5, which is the end of the first phase and the beginning of the second phase, the monocyte will be predominant during this area. These monocytes, it has phagocytic action. By the end of the first phase, new capillary pods will be formed near the edge of the wounds. Clinically, with the first phase, which is the phase of inflammations, it will be manifested by the features of acute inflammatory process, which are hotness, redness, tenderness, swelling, and loss of functions. The phase 2, it's called proliferation or granulation phase. That means the wound, after the body immunity make the first phase in straightforwards. So the phase of proliferation or granulation, it takes about 2 weeks. From the 5th day to the day 20th. By the day 5th, significant number of fibroblasts has begun to be synthesized. Collagen will form extracellular fibers framework that form a tissue and give the strength to the wound. So, in general, when there is wound in the areas in which there is no tensions, the wound can be healed within 24 hours. For example, if we are doing thyroid surgery, we can remove the stitch if there is no tension, and if the patient is not obese, within 48 hours, and it will be very nice scar. But within 48 hours in the area in which there is high blood supply, like in the neck, and there is no tension. But it will be difficult if it is in the abdomen or in the oral cavity and it is moved. Okay? So because the collagen, which forms extracellular fibers framework from the tissue and gave the strength to the wound. Ground substance in which the fibers are embedded there will be thin gel in connective tissue, contains water molecules, electrolytes, mucopolysaccharides, and glycoproteins. All these ground substances, they are nutritional substances in which they will help that the wound become strong. Phase 3, it is the scar phase. It is the phase of differentiation. It starts in the day 21st. It will start in the day 21st onwards and contain identifiably but as average up to the week 14. لاحظوا الأسبوع رقم 40 يذكرنا بالحمل. يعني so that the scar, the wound, it is like the intrauterine baby. It needs 40 weeks to be mature enough. يعني so the wound, it is like the baby. It needs 40 weeks to be mature enough. Okay? So up to the week 14. In this day, there will be continue identifying but as average up to week 14, no clear demarcation between proliferation phase and differentiation phase. There will be copious blood vessels. ما نفتكرش انه between the phase 1 and phase 2 في عندنا sharp line, there is intermingled وفي تداخل, okay, بين يعني between the phases, okay. So there will be differentiation phase, there will be copious blood vessels and remodelings of the haphazard arrangement of collagen. During the second phase واحنا نشتي نركز على النورمال هيلينج حتى بعد نعرف موضوع الدايابيتيك ونتائجه كيف بتخربط لنا هذا الموضوع بالكامل. Okay. In the يعني the third phase there will be rearrangements of the fibers and collagens which have been during the second phase. So in the third phase there will be rearrangements in order the wound will take its normal shape. Will occur and also type of collagen will be formed. There will be repair of epithelial surfaces. The scar phase, which is the third phase, biologically has 3 stages. So the third phase, which is from the day 21 up to the week 14, it has 3 stages. Okay, the phase 3. Stage 1, it is in the first 4 weeks. Stage 2, from the 4th week to the 12th week. And stage 4, from 12th week up to the week 14. What is now? We talk about the normal histological change during normal person. Okay, during normal person. Now, what is the pathophysiology of diabetes mellitus in relation to the oral wounds? What will happen if the patient is diabetic? Patients with diabetes mellitus will have significant effect on process of oral wound healings due to the following. Number 1, there will be, as my colleagues mentioned before in the previous lectures, there will be high concentration of blood glucose, which is suitable media for growth of and multiplications of microorganisms. Okay, so this is the first challenge, that the blood glucose, it will be high in the area. This will result in what? In wound infection, okay? And high glucose in blood irreversibly bind to the proteins and lipids like collagen, hemoglobin, cell membrane protein, forming advanced glycations and products. So the blood sugar, when it is high, it will link with some proteins which form the cell membranes, RBCs in the areas, okay, ground substances, collagens. So it will disrupt the normal histological arrangement, which should be normal in the 3 phases. And these important things, which is the advanced glycation and products, will disrupt the wounds in great way. What are the effects of advanced glycations and products on the wound? What will happen when these substances is formed due to high glucose in the area or in the blood? Number 1, these advanced will cause collagen dysfunction. So number 1, there will be bad effect in the function of the collagen. Its function will be changed. As the collagen is the main structural proteins in scar tissue and periodontal ligaments, age cause abnormal cross-linking of collagen molecules, making them stiff and brittle. Okay? So the normal rearrangements of the collagens, it will be disrupted, result in stiff collagens, and not only stiff but also brittle. بتكون قوية ما بتكونش لينة، لكن أيضا بتكون إيش؟ تتكسر بسهولة، brittle. Okay? It will be brittle and less functional. Being incapacitations of immune cells. all the cells which are monocytes with the phagocytic activity will be disrupted, okay, due to advanced glycation end products. It will bind to immune cells receptors. بدل ما تروح الخلية للإميون ريسبونس وتقوي المكان، من بيروح مكانها؟ advanced glycations or end products. Okay. So it will disrupt neutrophils and macrophages. إذا النيوتروفيلز والماكروفاجز ما بتاخذش مكانها في الإميون سيستم in the area بشكل مناسب، لأنه حل محلها حد ثاني. يعني تخيل عندي أنا منظومة من أطباء الأسنان يشتغلوا بشكل متوازي، ابتداء من الطبيب العام والأخصائي بمختلف الاختصاصات، أجي أطرح داخلهم طبيب جراحة عامة ولا طبيب باطنية ولا طبيب جراحة مخ وأعصاب. أوكي هذا جيد بشغلهم، بس بيعملوا لي in the system of dentist work. So this will be affected in this area. So pro-inflammatory state and reducing their ability to engulf. Endothelial dysfunctions. Age damage the endothelial of blood vessels result in microvascular complications. Complications including thrombosis for the microcirculation. So the healing process will be disrupted. Number two, so all that affects due to just high glucose level directly in the area. The second effect is microvascular ischemia per se, not just as a secondary of high glucose level, but there will be direct effect on the microvascular ischemia in the microcirculations to the endothelium, so the mucous membrane of all the small blood vessels throughout the body, including the oral cavity. Hyperglycemia and aches cause thickening of the basement membrane of the capillaries, which cause narrowing of the lumen. So when there is microvascular injury, there will be effect and severe inflammatory process result in narrowing of the diameter of the micro blood vessels. So the nutritional substances and the blood supply to the area and even the oxygen will be disrupted to the area. So that will affect and make the healing is delayed. Hyperglycemia and aches cause thickening of basement membrane in the capillaries, which cause narrowing of the lumen, result in decreased blood supply. Impair delivery of immune cells and antibodies. In general, patients will get depressed immune system. So that the patient with diabetes mellitus, generally in his body, it has depressed immunity. Okay, in general, in all his body, immunity, it will be depressed. In addition to the depression of the immune defense in the area of the wound, including the oral cavity. Reduce clearance of the waste products. Also, another effect. When there is microvascular damage, even the waste products will be affected. So the waste products will accumulate in the area of the wound, so that make the wound is not healed well. Number three, the third effects of the hyperglycemia is diabetic neuropathy. And you know, all the neural system, it reaches to anywhere. And we have four major complications of diabetes: diabetic neuropathy, diabetic nephropathy, diabetic retinopathy, and also the wound itself, it will be affected locally. So which is one of the important complications of diabetes mellitus. It usually affects the peripheral nerves, resulting in loss of protective sensation. حتى المريض إذا صلحت له الوند في الأورال كافيتي بيكون عنده diabetic neuropathy. مثل ما ذكر الدكتور عبد الكريم، يخزن حتى غرفتين وصالة ولا يعبر، ما يشعرش إنه الجرح بيتأثر، أو يأكل أشياء حارة وما يحسش بحرارتها لأنه عنده diabetic neuropathy. If he has bad fetid denture, he will not feel that there is something affect the oral cavity. So diabetic neuropathy حتى احنا بالنسبة للجراحة العامة ممكن المريض يدعس السيجارة أو يدعس أي مسمار بقدميه وما يحسش، وبالتالي الجرح يتطور بدون ما يشعر المريض as a complications of diabetic neuropathy. Patient may have xerostomia will result. There will be loss of cleansing and buffering system. The pH of the body will be affected. Loss of antibacterial properties of the saliva because the saliva become with high blood sugar, so its antibacterial effect is lost or decreased, and increased plaque accumulation. What happened? Okay. As a result, the broken of normal pathway of the wounds healing will result due to interference with the face in their normal histological arrangements in chronological sequences. بيتأثر in phase 1, phase 2, phase 3 in all its 3 stages, so the wound healing will be delayed. يعني المفروض انه any wound in the body within 48 hours it will be healed. It will be tight water. Okay? ونخلي الخيط لفترة أطول, not because the wound is not healed, because there is tension, because there is what? يعني لما نعمل عملية في الأبدومين خلال 48 ساعة الجرح المفروض إيش؟ heal. ليش نطول الخيط إلى 8 إلى 10 أيام؟ حتى نمنع التنشن فقط لا غير. لكن في diabetic patients with immune depressed ما بيصيرش healing within 48 hours, بيطول أيام طويلة. Okay? Diabetic mellitus patient chronic hyperglycemia creates a distinctive internal environment that disrupt every phase of this process, turning a normally straightforward repair into prolonged high-risk repair. مش فقط بيكون عندي prolonged to the wound, but there is high risk for infection also, so it makes the problem more complicated. Many factors, by the way, not only the hyperglycemia will affect the wound healings. We have another things can affect wound healings, like the age, position of the scar, relation of the direction of the wounds with collagen fibers and ethnic groups. This is general things which can affect the wound healings, but when they are associated with hyperglycemic things, that will make the things complicated more. Home mistakes. What we should get from these presentations, as my colleague said, we should have home mistakes. Number 1, preventive measures, oral hygiene, regular dental checkup, protect your mouth, like abnormal teeth or badly fitted denture. We should visit you as a dentist, and food management, like solid foods or irritant showing cat or tobacco, it should be mitigated. These are preventive measures. Rapid call for help when patients has oral problem, wounds, ulcer, sore spots or anything, we should search for help. Meticulous wound care is important, should be kept clean, avoid irritations, follow instructions of the physicians. Meticulous wound care is important, should be kept clean, avoid irritation, follow instructions of the physician, good control of blood sugar. Thank you very much.
دكتور عبد الله بارك الله فيك. والله حطيت النقاط على الحروف. الونس. في سؤالين لو سمحت. الونس لما يخلص الكومبليت كيورينج او هيلينج هل بيرجع بنسبة 100%؟
الدكتور الطيار سأل سؤال مهم جدا. يقول انه when there is healing of the wound, is it will return back to normal? Actually depend on several factors. Was the case is emergency or not? Was the wound was parallel to the collagen fibers? وهذا مهم جدا. لما نجي نفتح الwound لازم يكون parallel to the collagen fibers, not to transect them. Okay. Another things, is there control of blood sugar and good hygiene? If this is the case, it can return back to normal. Okay? If this is the case, ومهم جدا بالنسبة للزملاء أنا أنه لازم أختار الوند خاصة بالإلكتيف لازم يكون باراليل على اللانجرش لاين كولاجين فايبرز. يعني مثلا في الرقبة إذا جي يعمل عملية في الرقبة لازم ما يقص بالطول، لازم بالعرض. ليش؟ لأنه الكولاجين فايبرز هي ماشية. أوكي؟ يا سلام. شوف، احنا في معانا اعتقادات كثيرة جدا. لما اعمل العسل في البداية معناته انا عملت له هايبرجلايسيميا. واضح؟ ما احنا الان كل جهدنا الان ايش نعمل؟ بكمل لك الان. لكن اذا عمل في وقت معين احنا بنعمل هايبر، ركز، هايبر اوزمولر اريا، هايبر اوزمولر اريا. ولذلك الان في شركه تصنع sugar granules وتكون highly concentrated. Why? Because when you put them in the wounds they will absorb the sugar of the microorganisms. ايش يصير بالمايكرو اورجانيزم؟ يموت على طول. اوكي، فهو موضوع العسل هي نفس الفكره، انه it will act as hyper osmolar area. لكن ما نجيش نعمله والجرح مليان قيح، مليان نيكروتيك تيشو. لا، لازم الجرح يكون نظيف تمام. واذا عمل العسل على الجرح هو بيعطي لنا نفس فكره الهايبر اوزمولار شوجر جرانيولز. الميكانيزم انه بيسحب البلاد الوتر من السيل ممبرين حق المايكرو اورجانيزم، يكون نوت بروتكتيف فيموت المايكرو اورجانيزم. اوكي دكتور؟